let's talk about discipline. Okay, so one large area that comes up frequently in primary care are parents who really have trouble disciplining their kids. So we have a child who's 2 years old having frequent temper tantrums when she doesn't get her way. She's particularly prone to tantrums in the supermarket when she wants a treat and it is denied. Okay, another really unusual scenario, right? So what are some things that we could be doing in primary care just to sort of help parents? A lot of parents just come in and they don't have any experience, and they really are talking to friends. People are using the social networking media to kind of get their ideas. I think social networks now are huge. Is that the experience of people in the room in terms of how parents are accessing information? They talk to each other online. And a lot of the ideas that they come in with really seem to stem from these kinds of dialogues that they're having online. Because I can tell when parents come in and they ask the same questions, or they sound like they all were talking to the same 10 people. And we see it with vaccines in my office. In terms of the questions that people ask about vaccines. I can hear the same question coming from one parent after the other, and I know they read the same material online. So I think online is really important piece of information, a source of information, but I think it's important for us to also provide the information to families, and the earlier the better. So what are some proactive skills that, yeah?
You brought up a very critical issue as we go forward, and this is the online community.
Yeah. Mm-hmm.
How do we, in all the proactive area, where do we begin to fit into that in a productive manner?
Did everybody hear the question? So where do we as professionals, where do we interface with families online? It's a good question. Maybe we could talk about it during the lunch break, but entering those discussions that the parents are having may not be the best. It may be intimidating for people if we sort of jump into those dialogues, but maybe there's opportunities in other ways for us to let people know that they can get in contact with us or refer them to online sources that have more valuable kinds of information. One time I decided to sort of listen in on years ago some of the dialogue in a chat room. But my email address is ktpedmd, and as soon as that showed up on there was this, oh my God, there's a pediatrician in the room here, So people started to shut down and got very intimidated. So that doesn't seem to be an effective way to kind of to jump into the conversation. Well, change my email address. But one thing I think that's really important is for us to sort of help guide parents by just giving them some of the proactive intervention skills for good discipline. So clear rules, consistency, routines. I think it's just to start when they're young. I'm sure you all seen kids who are waking up, babies, who are 6, 7, 8 months old, who are waking up 5 times a night. And the parents they just don't have a sense of how to really establish, even early on, some routines and some consistency in terms of dealing with their kids. They have no tolerance for their kids crying. They have unusual ideas about what crying, how long a child can cry for. And I think we can really help them really early on in terms of beginning to help them develop some sense of routine and limit setting. I think it's very important for us to do that. I had one family who informed me that their child was starting on solid foods, and they were all now eating baby food in the family, including the parents, because they didn't want their child to feel out of place. And I thought, all right, you know, what's this kid going to be like? Now, this child's now a year and a half. What's she going to be like in another couple of years? You know, that's a little bizarre, I thought, but this is kind of what's out there. I mean, they're probably a little bit extreme, but this is a kid who never has any sense of limit setting rules, and you know that it's okay for a parent to eat food that the child's not eating, and what's the message that's being sent to this child? But this is what I think parents are struggling with in terms of, you know, what's okay to do. And if you look at the literature, there's so many different things out there that people can access, and they often conflict with each other, and parents are really clueless. So there's no Dr. Spock, you know, in this generation who just sort of stands out and everybody reads, you know, one person who's sort of the universal professional. And I think families are really, really lost. So I think it's really important for us to help them get a grip on some of the things that are important, and reinforce what's normal and what's not normal, and help them feel comfortable setting limits and rules for their kids. Giving directives. Having a, you know, parents need to be instructed. You can be polite but authoritative. You know, can you please put that away now? Versus, honey, would it be okay if you put the toys away? And I hear parents saying those kinds of things in my office. You know, I have parents turn to their 2-year-olds. Would you like a today? You know, I can't think of anyone that said yes. But this is really inappropriate. You know, when the parents sort of having this discussion with a 2-year-old, they need to learn how to sort of, you know, but again, it's this kind of, I think, internal confusion about what's appropriate and how to process things appropriately and developmentally with kids. Praising effort versus accomplishment. I think, again, it's something we can reinforce, that, you know, you worked really hard on that, you know, I'm very proud of you, versus, man, you know, your science project was the most amazing thing, you know, since Einstein, and, you know, you're obviously a genius, and lavishing praise versus on the work and effort that went into a project is probably a better way to go in terms of providing feedback. The concept of catching kids being good. You know, I see so many parents who are just, you know, yelling and screaming at their kids every time they do something, but there's not much going on in terms of recognition of appropriate behaviors. And if they don't take the time to recognize when their kids are acting appropriately and provide them with feedback, then something's, you know, is being lost. So thank you for, you know, playing quietly while I was talking on the phone. You know, thanks for behaving in the store when we went shopping. These are things that the parents really need to recognize and reinforce, so that the kids learn that these are the expectations, and they get feedback when they do things appropriately, not just when they do things inappropriately. So I think that's really important to encourage parents to really look for the things that the kids are doing well. And the concept of assigning chores and responsibilities. I still think it's important for kids to be able to do things around the house that are developmentally appropriate. And so many parents who really don't assign anything to their kids anymore. There's just no, you know, kids, the entitlement factor in terms of what's going on in this current generation just absolutely blows me away sometimes. And it's really important, I think, for kids to feel like they need to participate in what's going on in the house and clean up dishes or throw out the garbage or clean up their rooms. And parents really should be doing those sorts of things that are, when they're, you know, but they need to be developmentally appropriate. So, dear Billy, I missed you yesterday. This is a signing response. I was so full, I was hoping you would take me out to the sidewalk so that I could be emptied. Not only is it uncomfortable in here, but it's smelly. I don't know what your parents cooked for dinner this week, but I hope you did not have to eat it. Hope to see you this Friday. Look for me by the back door. So it could be done with humor, but it's important that it be done. Parents just need to remember to, you know, give their kids a hug. You know, it doesn't have to be for any particular reason, but just to, you know, again, parents often get lost on the negatives, but I think showing affection, positive time, such an important factor, particularly for young kids, and we'll talk about it with teenagers in a little bit too. But just some time that they isolate out of the crazy busy day, spend 15, 20 minutes just sitting and doing something that the child enjoys doing, that the parents can do together. And it shouldn't really be part of a reinforcement per se. It's just something that parents should just build into the schedule to spend some time with their kids. Very important when there's a new sibling. And I always tell parents, not only should they spend some time with the 2 or 3-year-old when they have a new sibling at home, but label it. This is now our special time together, because the kids are extremely resentful when there's a new baby in the house, and it's really important to build that time in. So, and I think just as it's important to do chores, it's really important to establish an atmosphere of mutual respect. And I watch these kids like flinging profanities, some of the teenagers, at their parents, and it's so inappropriate. And the parents just do nothing, and there's no rule ever been set that this is not okay to talk to us this way, and it just always amazes me. I had this kid in my office a few weeks ago, and he was just giving his father the finger the whole time we're sitting there talking, and you sort of have to smack your head and say, what is going on here? And what allows parents to sort of take such a back seat to establishing rules and for mutual respect? And I think it's important for the parents to in turn respect their kids and not curse at them and apply the same rules to themselves, but have civil dialogue. But I think it's important to talk about it and bring it up in our primary care settings. What are some useful tools? And Dr. Heisler is going to talk in a few moments about behavior mod, but some nice things to have around: kitchen timers. When I have a parent who says, my kid doesn't get dressed in the morning, it takes them really long time, just setting a kitchen timer and saying, you've got, 5 minutes, let's see if you can beat the clock. And using those kinds of things to motivate kids, sometimes it can be very helpful for young kids. Charting, putting stars and check marks on charts. Just saying, recognizing, again, getting back to catching the child being good, you got dressed this morning, and within 5 minutes, here's a star on the chart. And again, we'll talk about that in more detail in a few moments. But you don't even have to have it linked to a behavior mod program. Just it gives the child some direct feedback that they're doing the things that are being expected to be done. So I think charting could be a nice tool for young kids. And so for some kids, just articulating, for kids who aren't able to express themselves very well, when a parent says, it looks like you're really upset when they're dealing with their 2.5-year-old who can't really explain why they're having a tantrums. I know you wanted to keep on watching the program, but we need to go to the store, and I know you're upset. And just sort of speaking it for the child may sometimes really be helpful. So teaching parents to sort of help articulate for the kids, I think, is a useful proactive skill as well. When we want to teach kids to do something, there's sort of a couple of phases. Modeling, we could have the parent sort of show the child what they expect them to do, or do it themselves. If they're going to go into the store and the child typically tantrums or runs away, the parent can say, I want you to hold my hand for the next 5 minutes when we go to the store, and that's the expectation. And you do not leave. You hold my hand and walk around with me. But sort of explaining clearly what the expected behavior is, and then they have the kids practice. And then provide some praise when they do it appropriately, and a reward if they did it appropriately is helpful. So these are sort of the 4 facets of getting kids to sort of change behavior. Parents can, again, be taught how to do these kinds of things and just to think about it in that way. How about timeout? Who uses timeout in their office? And how many parents have said it doesn't work? I hear that all the time. I tried timeout, it doesn't work. So there's ways to do it, and there's ways to do it. So when I hear parents say it doesn't work, or the parents tell me that the child told them they don't care, you can put me in timeout all day, it doesn't make any difference to me. Truth is, it does, but they have to do it effectively. So we talk about, there's a wonderful book out there, 1, 2, 3 Magic, by Thomas Phelan. So that's a book that we should probably all have in our offices, and probably have parents of young kids read. particularly if they're having problems with limit setting. But effectively, for the kids who are non-compliant, the 1, 2, 3 magic technique is simply you give 2 warnings. You know, I would like, you need to clean up your toys now. Nothing happens. That's 1. The parent waits a few seconds. You need to clean up your toys now. Nothing happens after another few seconds. Fine. 3, take 5. That's the concept. So 1, you need to you clean up your toys. 2, you need to clean up your toys. You need to clean up your toys. That's 3, into timeout. Not spending a lot of time processing why they don't want to clean up their toys. They just need to do it. Parents really spend much too much time trying to talk their kids into doing things. And for 2, 3, 4, 5-year-olds, it just isn't working very effectively. And some parents really need to, the kids need to recognize that when a parent says something, there's going to be an action followed if they don't comply. And most kids learn that they can procrastinate and not listen to what their parents are saying, and the parents will just go on and on and on and on, and the kids just have learned that they've been taught to non-comply, basically. What about timeout? Well, roughly we suggest 1 minute per year of age. The location can be a chair, stairs, room. It should really be boring. Kids shouldn't be having their laptop and their cell phones and in their video games on their lap when they're in timeout. They really should be isolated where there's no other people around to interface with. If they're siblings, if they're friends, they need to leave, or the kids need to go somewhere where there's no interaction, and they need to just sit there and sort of think about why they're in there. One of the things that parents sometimes do when the kids come out of timeout is say, all right, demand an apology or want to process what happened right then and there. Generally, I think it's better to do it when everybody's calmed down much later than to try and do it right at the tail end of a timeout. When children say they don't care, they often do. Most kids just do not want to sit in timeout for a half hour or an hour and just be bored. I always like to warn people that misbehaviors may escalate while they're doing these interventions. So I warn people it's going to take a few weeks for this to turn around, and things may get worse before they get better. Same thing if I do one of these. Steve Mann will talk about sleep problems, but if I have a parent who's going to implement sort of one of the behavior mod Ferber techniques, I'd like to warn the parents, this is going to get worse before it gets better. If it doesn't, that's great, but if it does, they're prepared. They can use a car when they're out in public. So if they're in a store, taking the kids and putting them in the car and just standing outside the car is a great place just to have a timeout for a few minutes for a child who's acting out and is embarrassing their parent in a public place. And sometimes we need to time out the siblings as well. So everybody needs to go.
Actually, I can also do time out in the grocery store. Like once I have a kid that was misbehaving, I just make him face an out.
Mm-hmm.
Just stay there for 5 minutes.
Right in the store. Yeah. Yeah. Well, some kids, you can do that with some kids. Some kids will just start screaming and yelling, and it's so embarrassing to the families that they just sort of kind of yield to whatever's going on. So at that point, it's reasonable for a parent to just take the child out of the public place where they're not going to be embarrassed and just put them in a setting where it's more controlled. If a child is okay doing that and it doesn't escalate, that would be reasonable too. Temper tantrums. My approach to kids with temper tantrums that aren't really so out of control is just to have the parents ignore it. Just walk away for a little bit and let the kids do what they need to do until they calm down. For most kids who are having temper tantrums, I think that's an effective intervention. Often we don't need to do much more than that. We need to anticipate what kinds of things may cause temper tantrums for young kids. So if they haven't been fed or they're really tired and they haven't taken their nap, maybe that's not the best time to go shopping. So just some simple common sense, but sometimes we help parents connect the dots. But just a little bit of anticipation, feeding the child or making sure they go after they had a nap, it can really help the situation immensely. Some kids can just be redirected, when they're having issues or they're really upset about something, and they want something right then and there, the parent can kind of try to redirect them and say, let's try this right now, or you can give a child, if they're having a tantrum because the parent said, I want you to wear this set of shoes. The parent can say, here's the choice between these shoes and these shoes. Which would you like? Sometimes it sort of breaks up what's going on. I tell parents it's okay for kids to have temper tantrums. It's kind of normal. And kids really need to learn how to self-soothe. Again, it goes back to infancy when we see parents who just won't let their kids cry. And it's okay if your child cries for a little while. If your child cries for a little while, they're actually going to learn how to kind of calm themselves down. And it's not necessarily a bad thing. But again, unless someone says that to them, they may not be able to sort of take that in. But I think with a professional saying that it's really valuable for your child to learn how to kind of self-regulate and self-soothe. And if your child's frustrated because they can't put the puzzle together and they have a tantrum, it's okay for that child to experience the frustration and really start to learn some self-soothing on their own without having someone always step in externally. So I think it's important for kids to, tantrums aren't necessarily bad. And the change, do the unexpected. This sort of comes out of Milton Erickson, who's a psychiatrist who sort of was the father of the, I guess, family therapy and the neuro-linguistic movement, sort of one of the forefathers. But one of the things that he would do would sometimes have a parent try something that was really unexpected. So when they're so locked into this pattern and the parents get upset and the kid's tantruming, he would actually have the parents ask the kids to scream louder. And it totally breaks up the interaction. So doing something, you're not screaming loud enough, you should scream a little bit louder. And the kids are like so bewildered, sometimes the tantrums would just stop. I had a kid in my office with ADHD, he's like 9 or 10, and very oppositional. And I was trying to do an exam on him, and he came in for a cough, and I said, could you breathe? No, he's not going to breathe. He's holding his breath. Could you breathe? No. I mean, the more I ask him, the more he's going to dig in. So I asked him. I said, "All right, just breathe on your left side." And the kid looked at me like it just totally threw off the interaction. And he started. He thought that was funny, and the whole thing stopped right then and there. And I was able to complete my exam. But sometimes just doing the unexpected and sort of, when you're locked into this interaction, this kid's reflex was whatever you ask them to do, they're always going to do the opposite. Well, he couldn't do that, when I asked him to breathe on his left side. So, these are things that sometimes parents can just sort of break up the interaction by doing something that's a little bit out of the usual. Temperament we talked about earlier. Again, I think the most important thing is recognizing the kid with difficult temperament and trying to demystify it. And we talked a little bit about that. All right, a little bit about consequences for older kids when they are doing things that are inappropriate. There are natural and logical consequences that should be applied. They need to be realistic and enforceable. So when a parent totally loses it and says, you are docked and you're going to be grounded for the next 12 months every weekend, it's probably not a realistic way to intervene. And loss of privileges or restitution is what makes sense. So if someone stole something, broke something, they need to replace it. They need to do work around the house to kind of do restitution. These are the kinds of things that kids and parents should be taught to do when they have engaged in misbehavior. Yeah. About corporal punishment? I mean, I always advise parents not to go that route. That's why we talk about timeout and ignoring temper tantrums and doing the timeout. I think the timeout gives people who are prone to using corporal punishment another alternative that doesn't require them having to lay hands on the kids. So that's what if I get the sense that they're going to do that, I always will reinforce with families that that's not the way to go. It's not an effective way. It actually can backfire. And here's another technique that's much more effective, I think, and won't be as traumatic to your kid. So that's where I like to use the timeouts. Teenagers, big problem. Why is it a big problem? because they're working, parents and the kids are working at cross purposes. So, parents want their kids to be safe. They want them to make good, wise decisions. The kids just want to be left alone. They want to do things on their own. They want to create distance. So we've got people kind of working at two different agendas. So what are some things that we can do with teenagers when I work with a family or parents? These are some of the things that they basically need to do. This also comes out of Thomas Phelan's book, which is another book that he wrote for parents about adolescents and teens. Well, some things we do nothing. When a parent finds that their kid's room is really messy, is there something they absolutely have to do? Is there some things that we can just let go and just let the kids experience their own, if that's what they want to do, maybe it's not worth a headache or having a conflict about certain things. So there's, sometimes I just tell parents, is this really important? Who owns this problem? And, can you live with the child's messy room? And is it really worth intervening and creating lots of ill will about this? There's the consultation where the parent can come up to the child and say, do you think we can talk about such and such? Here's some thoughts I had about what you could do in this particular situation. But I think if parents do that, they need to be warned that as consultants go, people are not obligated to take the recommendations. So if you're taking the consultation approach, the parent needs to know that the kids may listen, but they may choose to ignore it. So that's one approach. The next approach, which we're going to talk about later, is negotiation. I think that's a skill that a lot of parents and teenagers really could use some fine-tuning on in terms of how do you problem solve when you're logging heads, how do you get past all this? And then finally, if kids are doing something that parents deem really dangerous, they have to take charge. And I think if there's some where the child is going to harm themselves or harm other people, parents have to step in and just sort of take charge and take over what's going on, and there's no more room for negotiation. So those are sort of the kinds of things that parents can do with their kids. For teenagers, though, I think really, and we're going to talk about communication later, but the relationship building is really key. So it really the biggest problem I see, as I said earlier, is that parents have trouble making the jump from being autocratic to really being able to let go and negotiate with their kids and give them more sort of spheres of freedom. And that's where they really seem to lock heads all the time. And a good relationship with their kids, and we'll talk about how do you build a good relationship, really is key to successfully negotiating adolescence, I think. And if parents and their kids aren't getting along, it's just not going to work out very well for them, particularly when the kids get into substance abuse issues and sex. If there's not a good open relationship where the families can talk about what's going on together without the parents becoming dictatorial, they're going to have a lot of trouble negotiating those years of adolescence. So I will end here. Any questions? Yes? Yeah. Yeah, I think timeout for a 1-year-old is probably, I don't think most 1-year-olds are going to understand the concept. When I have a parent who's telling me my 12-month-old or my 14-month-old is biting, putting them in timeout, I don't think is really very effective at that age. What I do suggest to parents is that they very dramatically pull the kid off and say no, and you want to convey disapproval. And that's what's more important, in terms of reinforcing that every time the child does that behavior, the parent sort of intervene the same way consistently. But to put a child in timeout at that age, I think makes no sense because I don't think they have any idea what they're doing. But I think they're trying to teach the kids some social skills at that age. But for a child who's 2, 2.5, 3, these kids are often pretty cognizant of what they're doing and that they've crossed the barrier, and then I think it works more effectively. Now, the idea is to really leave kids in timeout until they kind of calm down. So for an older child, let's say you have a 5-year-old, the 5-minute rule is that, you basically need to be sitting there quietly for 5 minutes. So if the kid's been screaming the whole time, the timeout really hasn't started yet. So I think that's what the other thing is, if you take a child who's screaming out of timeout, you really haven't accomplished anything. So that 5 minutes may take an hour to arrive at. Now, for a younger child, we're a little more flexible, and I would suggest that parents, wait till the 2 or 3-year-old tantrum is sort of stopped for a minute or so, or 2 minutes or whatever, but they don't, you don't have to have a long period of time where they are no longer tantruming, but you need a little more flexibility. But for an older child, you really want them fully calmed down for such a period of time so that when they emerge, things have settled down for them. Yes?
I've always struggled with the concept of ignoring a child who's visibly upset, especially a young child. And not because you certainly don't want to feed into their temper and reinforce it. But by the same token, I struggle with this concept because if you're really upset with me, you don't want to be ignored.
Right.
So how do you deal with that? Sometimes when I'm seeing patients, I'll say to them, look, you acknowledge that they're angry. It's okay to be angry, but it's not okay to throw the spoon at your brother when you're mad.
Mm-hmm.
And giving them an alternative behavior rather than just that would be acceptable. Does anybody else struggle with that issue?
Well, yeah, and I think, again, flexibility. So if for the child who's having repeat temper tantrums, where the parents have sort of locked into that kind of intervention and that's just not working for them, just stepping away for a few minutes, I think, makes sense. Or, if the kid's, upset about something and they start, it's certainly okay, to, as we said earlier, to articulate for the child and to sort of step in or ask, or ask them what they, what they're upset about. But for a child who's just repeatedly tantruming, as a lot of kids do, I think some of the parents just are struggling with what to do, and going in there, holding them tight and talking to them isn't working at this point. Just stepping away, giving everybody a breather, let the kids kind of work it through, and then come back, I think, is an effective intervention. So you can do either one, but if one's not working, then the ignoring, I think, can be an effective intervention. Yeah. Yes.
And your 2-year-old doesn't understand that. What age do you think you should do a little bit more of an explanation of why the behavior was bad?
I think when kids are like young school-age kids who are cognizant and have the cognitive whereabout to process what's going on, it makes sense. I think for a 2-year-old or a 3-year-old, you could offer some explanation, but the more people talk, it becomes ineffective, and they become increasingly non-compliant. So, and then we'll take some more questions at lunch. So I want to get on to our next talk, and I'm going to introduce Dr. Heiss.